Have you ever felt exhausted for no clear reason? Struggled to focus, forgotten simple things, or noticed strange tingling in your hands and feet, and assumed it was just stress, lack of sleep, or getting older? What if your body has actually been warning you about a silent vitamin deficiency that can slowly damage your nerves, affect your memory, increase your risk of depression, and even accelerate brain aging? One tiny nutrient plays a critical role in almost every major system in your body, and millions of people are deficient without even realizing it. Today we're talking about vitamin B12, one of the most essential nutrients for human health and one of the most overlooked causes of fatigue, brain fog, nerve problems, anemia, mood changes, and long-term neurological decline. The scary part is that many people live with low B12 levels for years before discovering the real cause of their symptoms. And by the time they finally connect the dots, the deficiency may already be affecting their brain, nerves, blood cells, and energy production in ways they never expected. To understand why this vitamin matters so much, you first need to understand what B12 actually does inside the body. Your nervous system depends on it, your brain depends on it, your blood depends on it, even your DNA depends on it. Without enough vitamin B12, the body simply cannot function at its full potential. One of its most important roles is helping create myelin, the protective coating that surrounds your nerves and allows electrical signals to travel quickly and efficiently throughout the body. Think of myelin like insulation around electrical wiring. Without proper insulation, signals slow down, communication becomes faulty, and the system starts malfunctioning. That's exactly what can happen inside the nervous system when B12 levels drop too low. And that's why some of the earliest warning signs of deficiency are neurological. Many people begin experiencing burning sensations, tingling, numbness, or pins and needles feeling in their hands or feet. At first, it may seem harmless. Maybe you think you slept in a strange position or sat too long. But when the nerves begin lacking the nutrients they need, these symptoms can slowly become more frequent and more noticeable over time. What makes this even more important is that vitamin B12 works closely with other brain-supporting nutrients like omega-3 fatty acids and choline to maintain healthy communication between neurons. Your brain is constantly sending electrical messages at incredible speed, and B12 helps those signals travel efficiently. When levels are low, many people describe feeling mentally slower, less focused, less sharp, and emotionally drained. One symptom people rarely connect to vitamin deficiency appears right inside the mouth. Your tongue can actually reveal clues about your nutritional health. Normally, the surface of the tongue contains tiny textured structures called papillae, which give it its slightly rough appearance. But low B12 levels can sometimes cause the tongue to become swollen, smooth, inflamed, or unusually red. Some people even notice changes in taste sensation. These signs are easy to ignore, but they can be important signals from the body that something deeper is happening internally. Then comes one of the most common symptoms of all, fatigue. Of course, fatigue can have hundreds of possible causes: poor sleep, stress, hormonal issues, chronic illness, emotional burnout. All of these can play a role. But vitamin B12 is deeply involved in the body's ability to produce energy at the cellular level. Your cells rely on a molecule called ATP, essentially the energy currency of the human body, and B12 helps support the biological processes required to produce it efficiently. When levels are insufficient, many people feel constantly drained, no matter how much they rest. And the effects don't stop there. Vitamin B12 is also essential for creating and repairing DNA, the genetic blueprint found inside every cell of your body. Healthy DNA repair and proper methylation processes are critical for long-term health, healthy aging, and normal cellular function. When these systems don't work properly, the body may experience increased oxidative stress, faster cellular damage, and a greater risk of disease over time. This is one reason why chronic nutrient deficiencies can quietly affect the body for years before major symptoms appear. But perhaps one of the most frightening consequences of low B12 is what it can do to the brain. Many people with deficiency describe something difficult to explain at first. They say they just don't feel mentally normal anymore. Their memory feels weaker. They forget conversations. They lose focus more easily. Their thoughts feel slower. They struggle to process information as quickly as before. Some call it brain fog. Others describe it as mental fatigue or cognitive slowdown. Whatever the name, the experience can be deeply frustrating and even frightening. Vitamin B12 plays a major role in memory formation and neurological function, especially in brain regions involved in converting short-term experiences into long-term memories. That means deficiency doesn't just affect energy. It can affect learning, concentration, productivity, and long-term cognitive health. Researchers have even linked chronically low B12 levels with a higher risk of cognitive decline and dementia later in life. What's especially important to understand is that many people develop these symptoms slowly over years without realizing nutrition may be part of the problem. Some individuals follow extremely restrictive diets for long periods without properly supplementing vitamin B12 and eventually begin noticing worsening memory, difficulty concentrating, mental exhaustion, and neurological symptoms. The encouraging news is that in many cases, these problems are not permanent. When the deficiency is identified early and B12 levels are restored, many people experience major improvements in neurological function and mental clarity. And there's another surprising symptom that often gets overlooked: balance problems. Some people with low B12 begin noticing subtle instability when walking, dizziness, or difficulty maintaining balance. If there's no injury, no major muscle disorder, and no obvious explanation, vitamin deficiency is something that absolutely deserves attention. In some cases, low B12 may even contribute to tinnitus, the ringing or buzzing sound some people hear in their ears. Again, these symptoms can seem unrelated at first, which is exactly why deficiency is so often missed. But the deeper we go into this topic, the more serious the picture becomes. Because some of the most significant consequences of vitamin B12 deficiency involve depression, anemia, and long-term damage to the nervous system. And what many people still don't realize is that mood disorders are not always purely emotional or psychological. Sometimes the body itself is contributing to the problem in ways most people never investigate. One of the biggest misunderstandings about depression is that people often treat it as if it has only one cause. But the reality is far more complex. Two people can experience similar emotional symptoms while the underlying biological causes are completely different. Chronic inflammation, nutritional deficiencies, poor gut health, hormonal imbalances, low vitamin D, omega-3 deficiency, and especially low vitamin B12 can all affect the brain's chemistry and emotional stability in powerful ways. This is why some people feel emotionally exhausted even when nothing obvious seems wrong in their lives. Their motivation disappears. Their concentration fades. They feel mentally flat, emotionally numb, irritable, or disconnected from the world around them. And while emotional stress absolutely matters, the physical condition of the brain matters too. Your brain is not separate from your body. It depends on nutrients, blood flow, neurotransmitters, and healthy nerve communication every second of every day. Vitamin B12 plays a critical role in the production and regulation of important brain chemicals involved in mood and mental function. And when levels remain low for long periods, the nervous system can struggle to function normally. Inflammation may increase. Nerve communication may slow down. Energy production drops. Mental resilience weakens. Even serotonin balance can be indirectly affected through gut health and metabolism. What makes this even more fascinating is the connection between the gut and the brain. Inside your digestive system lives an enormous ecosystem of bacteria known as the gut microbiome. These bacteria don't just help digest food. They also influence immune function, inflammation, nutrient production, and even mood regulation. A healthy microbiome can support the production of certain vitamins and neurotransmitters, while an unhealthy one can contribute to inflammation and poor mental health outcomes. This means that improving mental well-being sometimes requires looking beyond emotions alone and investigating what's happening biologically inside the body. In some people, correcting nutritional deficiencies, improving diet quality, restoring gut health, and reducing chronic inflammation can significantly improve mood, focus, and overall cognitive performance. It doesn't mean every case of depression is caused by vitamin deficiency, but it does mean these physical factors should never be ignored. And then we arrive at one of the most dangerous consequences of severe vitamin B12 deficiency: anemia, specifically a type called megaloblastic anemia. This condition develops because the body cannot properly create healthy red blood cells without enough B12. Red blood cells are responsible for carrying oxygen throughout your body, and when they become abnormal or insufficient, every organ system begins feeling the effects. People with this form of anemia often experience pale skin, weakness, shortness of breath, rapid heartbeat, dizziness, and extreme fatigue. But unlike ordinary tiredness, this fatigue can feel overwhelming because your tissues are literally receiving less oxygen than they need. Even simple tasks can become exhausting. Walking upstairs may leave you breathless. Concentrating at work may feel impossible. Some people even experience heart palpitations because the body is trying to compensate for reduced oxygen delivery. The reason this happens goes back to DNA production. Vitamin B12 is essential for creating new cells properly, especially cells that divide rapidly, like red blood cells. When B12 is missing, the body struggles to produce normal, healthy blood cells, and the consequences gradually spread throughout the entire system. At this point, many people start asking the obvious question: if B12 deficiency can affect the brain, nerves, energy, mood, blood, and memory so dramatically, how do you actually fix it? The first step is understanding where vitamin B12 comes from naturally. For people who eat animal products, the richest natural source of vitamin B12 is organ meat, especially liver. In fact, the liver stores extremely high concentrations of B12 because animals themselves rely on this vitamin for survival. Other excellent sources include red meat, fish, poultry, eggs, and dairy products. This is one reason why strict vegan diets carry a significantly higher risk of B12 deficiency if supplementation is not carefully planned. Vegetarians who still consume eggs or dairy usually have lower risk than individuals avoiding all animal products entirely. But even among omnivores, deficiency can still occur, especially when absorption problems exist. For people following vegan diets, there are still several potential sources of B12, although some are more reliable than others. Nutritional yeast is one popular option because many brands are fortified with vitamin B12. Certain algae, such as chlorella, may also contain forms that can support intake better than others, like spirulina or nori, which may contain analog forms not used efficiently by the human body. Some mushrooms and fermented foods may also contribute small amounts depending on how they are produced. But there's another layer to the story that most people never hear about. Your gut bacteria themselves can influence vitamin production and nutrient balance. A healthy microbiome can help support the production of certain vitamins, including vitamin K and potentially some B vitamins. However, these beneficial bacteria need proper nutrition too. They thrive on fiber-rich foods, especially soluble fibers that act as fuel for healthy microbes inside the digestive tract. Foods rich in soluble fiber, including certain vegetables, seeds, legumes, and prebiotic compounds like inulin, can help nourish these bacteria. Some people even use soluble fiber supplements to support blood sugar balance and gut health while feeding beneficial microbes at the same time. It's another reminder that nutrition is never just about one vitamin in isolation. The entire system is connected. However, when deficiency becomes significant, food alone may not be enough to restore levels quickly. And this is where supplementation becomes extremely important. Depending on the severity of the deficiency, many individuals may require much higher doses temporarily in order to rebuild their body stores and reverse symptoms more effectively. But here's where things become even more interesting, because not all forms of vitamin B12 are exactly the same. Some are easier for the body to use than others, and understanding this difference can completely change how effective supplementation actually is. When most people buy a vitamin B12 supplement, they assume all forms work the same way. But the truth is far more complicated. Different forms of B12 are absorbed, processed, and utilized differently inside the body, and understanding this difference can help explain why some people improve quickly while others continue struggling with symptoms despite taking supplements regularly. One of the most common forms found in supplements is cyanocobalamin, a synthetic version of vitamin B12. The body can absolutely use it, but there's an important detail many people don't realize. Before cyanocobalamin becomes biologically active, the body must first convert it into usable forms through several metabolic steps. That means the process requires energy, proper enzyme function, and efficient metabolism. During that conversion process, some efficiency is lost along the way. This is one reason why many cyanocobalamin supplements contain extremely large doses, sometimes hundreds or even thousands of times higher than the minimum daily requirement. The body absorbs only a fraction efficiently, so higher doses are often used to compensate. Then there's another form called methylcobalamin, which many experts consider closer to the active form the nervous system prefers. Because it's already in a more biologically usable state, the body may process it more directly in certain situations. However, proper stomach acid and digestive function still play a major role in how effectively it's absorbed and utilized. And here's something important for people who eat animal products. The B12 naturally found in meat, fish, eggs, and dairy resembles these active forms more closely than many synthetic supplements do. That's one reason natural food sources can be highly effective for maintaining healthy levels when digestion and absorption are functioning properly. But this leads to a question that confuses many people. What if someone eats foods rich in vitamin B12 regularly and still develops deficiency symptoms? What if blood tests still show low levels despite a seemingly healthy diet? This is where the conversation becomes much deeper. Because consuming nutrients is only one part of the equation. Absorbing them is another story entirely. Your body must complete several critical steps successfully before vitamin B12 can actually nourish your cells. First, you need to consume enough of the nutrient. Second, the food itself must genuinely contain bioavailable B12. Third, your digestive system must properly absorb it. And fourth, your cells must be able to use and metabolize it efficiently. If any one of these stages fails, deficiency can still develop. And one of the most overlooked factors in this entire process is stomach acid. To absorb vitamin B12 effectively, the stomach needs a highly acidic environment. Normally, stomach acid levels are extremely strong, with a pH between roughly 1 and 3. That acidity helps separate B12 from food proteins, so it can eventually bind to another substance called intrinsic factor, which is essential for proper absorption later in the digestive tract. Without enough stomach acid, the entire absorption process becomes compromised. And this is surprisingly common, especially as people age. Many individuals assume acid reflux or indigestion means they have too much stomach acid, when in reality, some may actually have too little. As stomach acid production declines over time, nutrient absorption often declines with it. This becomes even more important when we consider how many people take acid-reducing medications regularly. Antacids and acid-suppressing drugs can absolutely be necessary in certain medical situations, but long-term reduction of stomach acid may interfere with the absorption of important nutrients, including vitamin B12. Certain medical conditions can also interfere with absorption. People who have undergone gastric surgery may struggle to absorb B12 normally afterward. Individuals with celiac disease, inflammatory bowel disease, or chronic intestinal inflammation may also have difficulty extracting nutrients efficiently from food. Even when diet looks perfect on paper, the body may simply not be absorbing what it needs. And there's another surprising discovery. Modern medicine has begun paying closer attention to Some medications commonly used today, including certain drugs prescribed for diabetes and even longevity-related purposes, may reduce vitamin B12 absorption over time. Many people never suspect their medication could quietly contribute to neurological symptoms or fatigue years later. That's why proper testing matters so much. Simply assuming everything is fine because you eat healthy is not always enough. Blood testing for vitamin B12 levels can provide valuable information, but some clinicians also look at related markers like methylmalonic acid and homocysteine, substances that often rise when B12 function becomes impaired inside the body. And there's a very important concept people rarely hear from standard health discussions. There's a difference between normal levels and optimal levels. A lab test may show that your vitamin B12 technically falls within the reference range, but that doesn't necessarily mean your brain, nerves, metabolism, and cardiovascular system are functioning at their best possible state. Many people operate at the low end of normal for years while still experiencing fatigue, poor concentration, mood changes, and neurological symptoms that quietly affect their quality of life. Optimal nutrient status is about more than merely surviving. It's about giving the body what it needs to function efficiently, maintain cognitive performance, support healthy aging, and reduce long-term disease risk. And then genetics enters the picture, making the situation even more individualized. Some people naturally methylate nutrients more efficiently than others due to genetic differences. This means one person may maintain healthy B12 status with relatively low intake, while another may require significantly more dietary support or supplementation to function properly. In other words, two people can follow the exact same diet and experience completely different outcomes. One person may feel energetic, mentally sharp, and healthy, while another develops fatigue, brain fog, and accelerated aging symptoms despite eating similarly. Human biology is deeply personal, and nutrient needs are not identical for everyone. But perhaps the most important lesson in all of this is that vitamin B12 deficiency is not just about feeling tired. Left unrecognized for too long, it can slowly influence memory, mood, nerve function, cardiovascular health, and even the aging process itself. And the earlier it's recognized, the greater the chance of preventing long-term complications before they become difficult to reverse. Because once you understand how deeply connected B12 is to the brain, blood, digestion, energy production, and neurological health, you begin to realize why this tiny vitamin can have such enormous consequences throughout the entire human body. One of the most dangerous things about vitamin B12 deficiency is how slowly it can develop. Unlike a sudden illness that appears overnight, low B12 often progresses quietly in the background for months or even years. The body adapts little by little. Symptoms become normalized. People blame stress, aging, overwork, poor sleep, or emotional exhaustion, never realizing that a nutritional problem may be silently affecting nearly every major system in the body. And because the symptoms can appear so unrelated at first, the deficiency is often missed completely. A person may experience fatigue and think they simply need more rest. Then memory problems begin, but they assume it's stress. Later, they develop tingling in their feet, poor concentration, dizziness, or mood changes. And each symptom gets treated separately instead of connecting the bigger picture. This is especially important because the nervous system does not heal instantly. When nerves remain deprived of proper nutrition for long periods, recovery may become slower and more difficult. Some neurological symptoms can improve dramatically after correcting deficiency, especially when caught early, but severe long-term damage becomes harder to reverse the longer it continues unnoticed. That's why recognizing warning signs early can be life-changing. The body almost always sends signals before major complications appear. Brain fog, numbness, burning sensations, poor balance, weak memory, unexplained fatigue, mood changes, pale skin, shortness of breath. These symptoms may seem ordinary on their own, but together they can point towards something much deeper happening beneath the surface. What's fascinating is that vitamin B12 deficiency also reveals something bigger about modern health. Many people today are technically fed, but still undernourished at the cellular level. Calories are everywhere. Ultra-processed foods are easy to access, but true nutrient density has become increasingly rare in many diets. The body may receive enough energy while still lacking critical compounds required for optimal brain function, metabolism, nerve health, and cellular repair. And the brain is often one of the first organs to suffer when nutrition deteriorates. Your brain consumes enormous amounts of energy every single day. It depends on oxygen delivery, stable blood sugar, healthy fats, vitamins, minerals, amino acids, and proper neurotransmitter balance. Even subtle nutrient deficiencies can influence focus, emotional resilience, motivation, and cognitive speed more than most people realize.